On behalf of the ATAF, the African Tax Administration Forum, I would like to register our appreciation to the government of Mauritius and the Mauritius Revenue Authority for graciously hosting us this week for this training, tobacco and excise tax. We are grateful for your support and for your hospitality to having and welcoming the continent to your country. We truly appreciate that. We also want to appreciate the support of the tax administrations present for supporting what ATAF is doing, but also for allowing their officers to come and attend this training. It's not an easy one, particularly in times of when each tax administration is considering optimal revenue collection, but having the officers sitting down for 1 week for the training, we truly want to appreciate that. We also want to thank our partner institutions, as mentioned earlier on, for the great work that we are putting together to bring together this program in the continent, as we are all aiming or targeting at enhancing the health of our citizens, the entire continent, through health taxation. Let me start off by just speaking briefly about what ATAF does. For those of us probably that have just landed on the terminology, ATAF, it stands for the African Tax Administration Forum, and our task, our mandate largely in the continent is to support member country. It's a regional body, member-led organization, currently sitting at 44 members in the continent, and we have mandate. And they are around a couple of pillars, one being the capacity building. This is what we do by providing trainings to member countries, but also technical assistance support. And we have been doing this for the past 16 years now. Our second pillar that we do in supporting the work is to conduct research, applied research and knowledge generation. And we have our applied research unit that leads this function, but also with a couple of publications that we produce on daily basis, and you can find them in our website, that also informs, provides more information to guide decisions that are being made at various levels of our daily operations. But we are also in charge of the police support and influence, which we are a voice of Africa on tax matters. Before ATAF started, most of the issues on tax matters in the continent were being decided by other organizations outside the continent. But with Africa now, we have become a voice. And so we have a presence at the organizational international setup, international global taxes, where we represent the continent, and we also participate in a couple of other decisions. And today we are also in a position where we put up our voice, and as we sit in those conversations, at least we speak for the continent. Fourthly, we are also we're not working in isolation, but we are in collaboration with other sister institutions that have similar interests, to make sure that together we do not reinvent the wheel, but rather we cooperate and we strengthen what we are doing to make sure that the continent becomes financially sustainable, as per the Agenda 2030, that is looking at having a continent that is self-sufficient in terms of financing. And the fifth pillar that we are looking at is to see that we have impact in the continent. Currently, our support through training, technical assistance, through the research work is yielding results. Countries are realizing collections are enhancing. We have a couple of millions that we have collected, but we also have more that have been assessed, and we look forward to have those coming into the coffers of the countries as revenue that is being realized in the end. Coming back to our program that has brought us together here, Honorable Minister, you will agree with me, currently our health systems are facing enormous challenges. There is a huge increase of non-communicable diseases that have, added a burden to our nation. There's an increase there's a limited domestic health financing, which we all know, but the effect of COVID-19 are still here with us. We are still talking about the pandemic and the things that it brought along with us, some economic shocks that we have, climate change, conflict, and some global inflation. All of these issues, they are somehow affecting our health system. So, and currently we have also experienced with the Trump administration, the changes and the diminishing, funds that goes to countries. They have gone down significantly, and there's such a shock in that space as well. So Africa countries, through the Abuja Declaration, which was held in 2001, committed to allocating at least 15% of the national budgets to support the health sector. Unfortunately, it is now more than 2 decades. If you read through the World WHO report of 2023, it is only 4 countries in the continent that have at least allocated the 15% of their budget to support the health sector. A lot of other countries, they are still operating below the 7%, which is still an issue, and we know the health situation in our continent. As such, most of the households are left, to have a burden, huge burden in terms of out-of-pocket payments, and which then makes it all complicated for families, and it is so difficult, the issue of supporting the countries in that space. So the rising debt crisis further makes African countries now to continue operating in such such lower margins in terms of supporting the health sector. And if you look at the issue of the spending amount that is committed in countries is becoming less, and the sectors that are critically affected, it is health, it is education, which are very basic and highly needed by our countries in the continent. So in light of all these challenges that we have seen up there, African member states, they are called for to look into more sustainable financing mechanism, and one being the domestic resource mobilization, which includes implementing health tax and innovative fiscal strategy to strengthen health system and achieve universal health coverage. So what is ATAF doing in responding to these challenges and supporting countries? So Africa work on health tax is grounded in the recognition that health taxes create a win-win situation, and delivering public health gains, generating government revenue, but also it will be a way of promoting equity and social justice. So while the evidence are very clear in terms of health taxation, definitely there are a bit of challenges that comes in their way. So in the case of tobacco products, WHO recommends that tobacco tax should comprise at least 70% of the retail price of tobacco products. 70% of the retail price of tobacco product. That is the recommendation by WHO. However, in Africa, the average tax share is only about 40%. So we are still at the very lowest margin as it has been recommended by the World Health Organization. So if countries, we are able to increase the health taxes by 50%, we could generate about 3.7 trillion in 5 years, and about 2.1 trillion being generated from low and middle income countries. If this is invested in health, it would increase global health spending by 12% and 40% in low and middle income countries in the continent. So this is an evidence study that has been conducted. So ATAF, what we do now, like I said, in collaboration with other partner organizations, we are designing and implementing effective taxes. We have put together our team, and this training being one of those products. This is our second time we have such a training. So what we are currently doing as ATAF, we have evidence and data that is being collected through our flagship publication, the African Tax Outlook, where we generate timely analysis on excise and health taxation to guide policy design. That is one area where now any country could access our publication and see the study and the data that is available through our African Tax Outlook, ATO. But we are also organizing capacity building. Like I said, this training that we have today, we trained last year, this year, and it is in our plan annually, at least to bring together the tax officials in the room to talk about these matters around the health tax. We are also providing technical guidance to countries. We are finalizing a policy and administrative guide on tobacco and excise taxation to provide some practical tools for government so that they are guided with technical, inputs to help them as they are considering how to enhance and, the issue to do with health taxation. We also have some tailored technical assistance to a country. Just recently, we provided some support to Zambia as a country in this space. So we are open and available, and we are also contributing into the continental and the global engagements together with the UN Subcommittee on Health Taxes, ensuring that African perspective, shape global standards. We also work with the World Bank, WHO, and other institutions, as I had mentioned earlier on. So this training, Honorable Minister, this week will be addressing a couple of those challenges and also to see where the gaps are and what could then help to inform, the deciding bodies what needs to be done in this particular space where we have, as it has mentioned, there are still some gaps that are there. So in conclusion, we urge and encourage every country present in the room to take advantage of support that is available and that ATAF is willing to support, so that together then we see how best we could elevate and enhance each other's skills and technical capabilities to be able to deal with the tax issues that are around health and tobacco aspects. So before I return the floor to Mr. Dayal, I just want to register our appreciation through you, Director General, that MRA has been very generous to ATAF, and we have an agreement. They agreed to host ATAF events here in Mauritius each year, and we are so pleased. And every time we come to Mauritius, we are like, wow. This morning alone, I was just saying, the last time I was here, this room had fixed chairs. What happened? They said, no, we wanted to accommodate your needs. So we just moved the chairs. I'm like, oh, wow. So such flexibility, and always it is stunning, but the hospitality, the team, the excellency, it is truly appreciated. So Manigam and your leadership, the HR department, the training school, we truly appreciate and value the support that you have given to ATAF, and we want to thank you so much for all of that support to ATAF. Thank you so much for your attention, and I thank you. Have a blessed day.